Medical staff and students at Alberta Children's Hospital are now able to practice life-saving care in Canada's largest pediatric patient simulation lab. The $2.3 million KidSim Centre was funded through donations to the Alberta Children's Hospital Foundation. It provides a simulated clinical experience where healthcare providers can hone their skills on lifelike computerized pediatric mannequins. The mannequins breathe, speak, and have a pulse and blood pressure.
We're able to use it for teaching, we're able to use it for research, we're able to evaluate new equipment, new procedures, new guidelines, adherence to guidelines. Like, really the sky's the limit, and it really allows those teams to look at their environments, and even areas like patient safety are impacted by this. Through our program, through all the years, we've come up with lots of latent safety threats that we were able to identify in the sim lab with equipment or with carts or with communication, where we really made a difference, I hope, in terms of impacting staff to a level where they feel more comfortable, more safe in their environment when those things occur.
KidSim is able to mimic situations within various areas of the hospital, such as the emergency department and intensive care units, operating rooms, and a variety of outpatient clinics.
We have 4 simulated labs that we've mocked up to be clinical spaces in the hospital. And so what we do here is we do all our training up here in the simulation center. So the labs are adaptable and they're flexible. So they can, from 1 minute, be an emergency room, the next minute they can be an inpatient suite, the next minute they can be a dental clinic. And so what we do is bring staff up here, we bring nursing students, medical students, we bring dentists up here, and what we plan on doing is giving them the opportunity to practice real-life clinical events.
Earlier this year, a team from the emergency department went through simulation training where they managed 14 scenarios involving a school bus crash. Many of the staff who attended these sessions were involved in helping patients from an actual bus crash a few months later. Many said they felt the simulation training added to their confidence and efficiency in managing the multiple patients and their families.
Learners may have a lecture on trauma, they may see some video, and then they get the opportunity to practice, use all the equipment, use all their skills, all their critical thinking, and the ability to work together as a team.
Well, I think the importance of this center, I think, to our community in Calgary and in Alberta is that for pediatrics, we're the largest now on-site simulation center in the country. Some other centers have nice, beautiful centers that are off-site. I think the advantage of this center for us, and the fact that the administration of the Alberta Children's decided that we could use this valuable real estate to do this, was that our learners who are practicing health providers can now come and do this as part of their work. So, we don't have to ship docs and nurses and respiratory therapists off-site somewhere where they may not be able to attend a half-day or a full-day course. But if they have a couple hours embedded in their day to do training, they can simply come up here and do that training. So the fact that we're on-site, I think, makes a significant difference. And I think is one of the real reasons to celebrate this center today.